We are starting your Invisalign treatment, and I'm so excited we get to go along this journey with you. Now let's go over your Invisalign instructions. What we have here is your initial toolkit here with your retainer case and your cleaning crystals. You'll also receive a series of aligners that will all be numbered in the sequence that you will be wearing them. In each of the aligner bags, you'll have an upper and a lower tray that are also individually numbered with either a U or an L with a number next to it that corresponds with the number on the bag. This will allow you to keep track of your trays. Now, the most important thing to remember is to wear your trays 20 to 22 hours a day. Whenever you remove them, try to think that you only want them out of your mouth for about 30 minutes at a time. You want to remove them to eat or drink anything besides water and when you brush your teeth. Please avoid drinking carbonated water or water with lemon, as this has additional acidic components. Now, when placing the tray in your mouth, it's important that you don't put the tray and then bite them into place. If they happen to be off center, they may bend. So what we recommend is lining up the front teeth, pressing it with your finger, and then pressing it in the back to make sure that they're fully seated before biting all the way down. Now, when removing the trays, remember that the attachments are on the outsides of your teeth. So when releasing the tray, make sure that you take the tray, push it away towards the cheek, away from the attachments, and that'll easily release the trays. Now, once it's off, you can actually grab the tray and start to pull away from the teeth. However, for some of you who have more attachments, you can release one side, release the other side, and then go ahead and it will be easier to remove. Now, make sure that you push away from the attachments towards the cheek. When brushing your aligners, you want to just grab a standard toothbrush. I don't use any toothpaste on that because that can scratch your aligners. And what you want to do is make sure that you hold the aligners stable in your hand. Make sure you brush the inside on all sides of the inside of the tray all the way around. Also, don't forget to brush the outsides as if you're brushing your own teeth. The outsides, the insides, and right on top. You always want your trays to look like the day you got them inside and out. This will ensure that no plaque accumulates within the trays and is sitting around your teeth as you wear the trays. In addition to what's included in your kit is what we call a clenchie or a chewy. Now let's go over how this will be done. When you have your aligners in place, you will have your attachments attached to your teeth. Anytime we seat the aligners, we want to make sure that we get a good fit of the aligner over the teeth. Now, to ensure that the tray has now been seated completely over the teeth, you'll use a chewy, bite down on the chewy, and wiggle the clenchie. And you'll want to move the clenchie around your teeth in order to truly make sure that your trays are seated fully, and also to massage the trays over the attachments to ensure a good fit. As well, you want to think of kind of exercising your teeth and bouncing them into the trays to make sure that they seat fully in the trays. Think about using this clenchie about 4 to 6 times a day for 30 seconds at a time. Now, if you feel your trays need a little bit of a deeper clean, you can use any type of retainer or denture cleaner that you can find at your local drugstore or online. As well, Invisalign has included their own set of cleaning crystals. Now, for a deeper clean, you can do a half hydrogen peroxide, half water soak for about 30 minutes. Now, don't forget, anytime your trays are not in your face, they're in the case. You want to make sure that you're using this case at all times because, trust me, your pets are going to think this is some sort of chew toy. Also, if you're ever putting this in your pocket, a backpack, a lunch bag, you want to make sure that the trays don't deform, so this tray will protect them. Now, one of the biggest mistakes that patients will make is actually wrapping the trays in a napkin if they forget their case. Now, what inevitably happens is somebody, whether it's you or someone else, thinks that this is trash. If for some reason you don't have your case, I would strongly recommend that you just leave that napkin open with the trays in this napkin. Now, if we've asked you to wear rubber bands, please make sure that you wear these rubber bands anytime your trays are in your mouth. Also, anytime you take them out, put a new one in. This ensures that you've got the strongest elasticity of the rubber bands. However, if you happen to have forgotten them, go ahead and put the old one back in. You will also notice that there may be some additional trays that we have not yet delivered to you. These are what we call our passive trays. When you reach the end of the set of trays that we've delivered to you, we will often do a rescan and additional photos in order to continue to move your teeth towards their final position. During this time, we want to hold your teeth in position and we'll give you these passive trays as needed. I'm so excited to be a part of this journey and can't wait to see your final smile. See you soon!